If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Appendicitis. The appendix is a small tube-like organ attached to the first part of the large intestine. It is located in the lower right part of the abdomen. Its function is not yet understood. A blockage inside of the appendix causes appendicitis. The blockage leads to increased pressure, problems with blood flow, and inflammation. If the blockage is not treated, the appendix can burst and spread infection into the abdomen. This causes a condition called peritonitis. The main symptom is pain in the abdomen, often on the right side. It is usually sudden and gets worse over time. Appendicitis is a medical emergency. Other symptoms may include swelling in the abdomen, loss of appetite, nausea and vomiting, constipation or diarrhea, inability to pass gas, low fever. Not everyone with appendicitis has all these symptoms. Appendicitis is a medical emergency. Treatment almost always involves removing the appendix. Anyone can get appendicitis, but it is more common among people 10 to 30 years old. Appendicitis tests. Tests are used for people with appendicitis symptoms. They can help diagnose appendicitis before it causes serious complications. What testing is done to determine if you have appendicitis? Blood test to check for signs of infection. A high white blood cell count is a sign of an infection, including, but not limited to, appendicitis. Urine test to rule out a urinary tract infection. For a urine test, you will need to provide a sample of your urine. Imaging tests, such as an abdominal ultrasound or CT scan, to view the inside of your abdomen. Imaging tests are often used to help confirm a diagnosis if a physical exam and/or blood test show possible appendicitis. Are there any risks to the tests? There is very little risk to having a blood test. You may have slight pain or bruising at the spot where the needle was put in, but most symptoms go away quickly. There is no risk to having a urine test. An ultrasound may feel a bit uncomfortable, but there is no risk. If you've taken contrast dye for a CT scan, it may taste chalky or metallic. If you got it through an IV, you may feel a slight burning sensation. The dye is safe in most cases, but some people may have an allergic reaction to it. What do the results mean? If your urine test is positive, it may mean you have a urinary tract infection instead of appendicitis. If you have appendicitis symptoms and your blood test shows a high white cell count, your provider may order an abdominal ultrasound and/or a CT scan to help confirm a diagnosis. If appendicitis is confirmed, you will have surgery to remove the appendix. You may get this surgery, called an appendectomy, as soon as you are diagnosed. Most people recover very quickly if the appendix is removed before it bursts. If surgery is done after the appendix bursts, recovery may take longer and you may have to spend more time in the hospital. After surgery, you will take antibiotics to help prevent infection. You may need to take the antibiotics for a longer time if your appendix burst before surgery. You can live a completely normal life without an appendix. Sometimes the tests misdiagnose appendicitis. During surgery, the surgeon may find that your appendix is normal. He or she may remove it anyway to prevent appendicitis in the future. Your surgeon may continue to look in the abdomen to find the cause of your symptoms. He or she may even be able to treat the problem at the same time. But you may need more tests and procedures before a diagnosis can be made. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.